I think it's important to understand where this symptom-based model has come from, and clearly from our diagnostic manual. Here's a slide looking at the evolution of the DSM. So in 1952, the diagnostic manual had 107 diagnoses. We are increasing every new DSM to 365 diagnoses in the current DSM-4. A 340% increase in the number of diseases in 42 years. How does that make sense to any clinician? There's no other medical specialty where we keep adding new names and new diagnoses. And what are we up to in our DSM-5? Well, there are many, many disorders that we are going to look to add, and this number will only increase. I have not heard about anybody eliminating names, and some of the new names that we're discussing are anything from temperate dysregulation with dysphoria syndrome, which describe many of our adolescents, and it's actually a term for adolescent behavior, or hypersexual disorder, which is going to be defined by a group of psychiatrists. How are we going to decide who's hypersexual and who's hyposexual? And some of the concerning ones are things like shyness, which is going to be added very likely into the DSM-5 because guess why? There are pharmaceuticals that are being developed for shy personality. My point is that our evolution of symptom-based medicine in psychiatry has really limited our thinking. And what I want to share with you in this presentation and in the talks that I'll be doing is that if we don't look for the cause, we'll never find the cure. And it's critical that we understand the cause of mental illness. And there are many, many causes, and tonight we're going to focus on just one very, very simple way of understanding some mental health disorders with an incredible, simple urine test. So we've been talking about physiological measurements, and what I'm going to share with you tonight is discussion around neuropeptides and a measurement in the urine and how food can affect these parameters. But adverse reactions to foods are historically and continue to be one of the most controversial areas of medicine. And we'll talk a little bit about why in a minute. But there are many, many different mechanisms where the body might tolerate certain foods. And I just want to use wheat and dairy as examples because there's always a lot of confusion. And it is what's going to be the focus of today's presentation on casomorphin and gliadorphin. The difficulty tolerating wheat could be because of an autoimmune disorder called celiac disease, which I think many of you are familiar with. And then there are a number of other mechanisms. There could be an IgG food allergy, IgE. We're going to talk about suboptimal levels of DPP4, a digestive enzyme. There are autoimmune disorders, and there are some people that have all the above or none of the above. And there's clearly a subset where all we know is that there's an intolerance to wheat or dairy where none of these tests come back positive, yet the patient feels terrible with symptom improvement by eliminating the above foods. Celiac disease, just briefly, is common. It's increasing. It's clearly underdiagnosed and undertreated. It's a genetic autoimmune disorder. People cannot tolerate protein gluten, and it results in the destruction of the intestinal villi where nutrients are absorbed, and malnutrition is the result. The relationship to mental health has been known for a number of years, and there are numerous studies looking at depression and anxiety in particular. This particular study was interesting because the celiac disease was diagnosed by pediatricians when the children were younger. They stopped the diet because they did not have GI symptoms, but as depression resulted, by quickly eating a gluten-free diet, those symptoms resolved. Briefly, the food allergies, there's lots of confusion between the IgE, which is the immediate hypersensitivity, and the IgG, which is the delayed hypersensitivity, which could also result in behavioral symptoms. I use the term tomato effect. It was based on an article written in JAMA, the Journal of the American Medical Association, in 1984. Why is it so hard for our colleagues in traditional medicine to accept the fact that food sensitivities or reactions to food affects behavior? And they describe this tomato effect based on the fact that tomatoes, which was commonly consumed in Europe in the 16th century, was avoided by the Americans for many, many years, because as part of the nightshade family, individuals thought that it was poison. So even though they were eating tomatoes, in Europe, it was over 200 years before this country they were eating tomatoes. And the cultural norm was tomatoes were poisonous, and it took an individual standing up in New Jersey, I believe, in Town Square, eating a basket of tomatoes and not dying before it was changed. I thought he made my heart beat faster, but it was the espresso talking. I think all of us are aware that food does affect behavior and nutrition does affect mental health. These are just a couple examples I've been using for years, but they are profound and really striking. That early studies by Dr. Galler following kids for 18 years on the island of Barbados. Malnutrition by age 3 resulted in dramatic increases in behavioral problems. By age 17, there was almost a 40% increase in hyperactivity and conduct disorder. Another dramatic study was with prisoners. Prisoners giving a vitamin supplement and an essential fatty acid supplement. It was simple. It was a few pills every morning for 4 months, published in the British Journal of Psychiatry, a 35% reduction in disciplinary offenses and 37% decrease in violent incidences. Again, a simple nutritional intervention resulting in dramatic behavioral changes. And what I want to share with you is another mechanism, how dairy and wheat might affect profound changes in behavior. Dairy and wheat are new in human evolution. And what we're going to talk about is the addictive quality of certain components of food, particularly dairy and wheat. So I don't think anybody is surprised about our new understanding about how food is an addictive chemical for the brain, and some patients are more susceptible than others. David Kessler wrote a well-done book called The End of Overeating, where he talked about how the food industry, using sugar and fat and salt to perpetuate this addictive cycle. And let's just take a minute to understand it. When we talk about addictions, we're talking about the neurotransmitter dopamine being released from an area of the brain in the prefrontal cortex. And this dopamine reward pathway can be stimulated by many activities, food, drinking, sexual activity, and clearly many, many drugs of abuse. Where food fits into this kind of reward pathway is theoretically where there is a lot of dopamine released, and patients will eat more, so they have a overstimulation of the dopamine pathway, and others may have a very low stimulation of the dopamine pathway due to not enough or poorly functioning D2 receptors. So we have this hyper response to food, where food triggers a much bigger reward, more dopamine released, and we're eating more, and this hypo response to food, where a smaller pleasure in foods, so you have to eat more and more to get that dopamine release. And the most powerful addictive component of food is clearly been shown in animal studies, and you just have to go to a chocolate bar at the local hotel to understand how sugar is a profoundly addicting substance. These are numerous studies done on rats that I won't go through. I'll be happy to send you the references, but daily binging on sugar for rats and compulsive overeating in rats. The last piece I want to share with you before we get to the neuropeptides is MSG, another profoundly addicting chemical that's added to our food supply. Here's a picture in front of you of scrambled eggs. I had a friend growing up whose family owned a Chinese restaurant, and a gentleman came in the morning and asked for eggs, and they said they don't usually have them, and he asked them, could he please just cook them some scrambled eggs? And like the rest of the food at this restaurant, this was in the early 70s, everything included MSG, so they made a plate of scrambled eggs with lots of MSG. The gentleman returned daily for many, many years as he shared with his friends that it was the best scrambled eggs he's ever eaten. Again, another process of how addicted a chemical added to food can be quite addictive and quite neurotoxic to the brain. But here's what I want to begin to share with you tonight is what happens to some people when they eat wheat and when they eat dairy. This is a patient that we treated in our day program here in Boston for an eating disorder. The patient began eating flour when she was 16 years old. She begins being depressed at that time but could not pinpoint specific thoughts that led her to eat flour, except that she enjoyed the taste of it. The patient associates eating flour with feeling relaxed and soothed. She currently eats 1 to 2 pounds of flour daily, with a maximum of 4 pounds of flour in one day. This is a girl that took flour, mixed it with water to make a paste, and ate it on a daily basis to feel relaxed and calm. We treated her at age 24 after struggling for 12 years with an eating disorder and profound OCD. We looked at a neuropeptide test and a positive to gliadorphin. And that's what I want to share with you. One aspect, one tool, if you may, in our toolbox is a simple urine test for casomorphin and gliadorphin. And casomorphin is the peptide derived from the milk protein casein, and gliadorphin is a peptide derived from the wheat protein gluten. Why are these peptides important? Because as you can see in the word casomorphin and gliadorphin, these are morphine analogs. They are opiate peptides. They react with opiate peptides in the brain, and they mimic the effects of opiate drugs similar to heroin or morphine. They can act as neurotransmitters in the brain, involved in multiple signaling mechanisms throughout the body. What is important and what is incredibly difficult for our colleagues in medicine to appreciate and understand is the concept of biochemical individuality. Every patient has a different response to medications, and patients have clearly different nutritional needs. And there's lots of good literature to support that, and is the foundation for the work that we do in integrative medicine. But morphine also has a tremendous variable response. If you ask 10 people that you know that were in a hospital for an operation and they had taken morphine, they might give you 10 different kinds of experiences, from incredible relaxing to making them nauseous and feeling ill. So there's tremendous interpersonal variability in our response to morphine as a drug. It could slow one person's heart. It could decrease the heart rate for someone else. Again, tremendous variability, a very important part of the work that we're going to do. So when we talk about casein and the formation of casomorphin, we're talking about all dairy products that have casein in it. Digestive enzymes in the intestine produce casomorphin, which is a smaller peptide. And then DPP4 is the digestive enzyme that causes the complete breakdown of casomorphin into simple amino acids. If DPP4 is inactive or deficient or functionally not optimal, there are going to be pieces of this casein peptide, casomorphin, that enters into the brain. The research of casomorphin has been around for a while, certainly since the 90s. Some of the earliest studies done in rats published in Autism Journal, where rats were treated with casomorphin, and at first the behavior became hyperactive, then antisocial, and then hiding their heads in the corner of the cage. If the individuals were pre-treated with naltrexone, which is an opiate blocker, so it blocks the receptors in the brain, these behavior changes did not occur, when the saline control animals did not exhibit any behavioral changes. So there's lots of literature. A lot of it is on the Great Plains website, where casomorphin has profound physiological effects in both animals and humans. Again, the early literature on autism and schizophrenia, I think the autism community has maintained fairly intensive testing, so it is more commonplace. The schizophrenia community has really failed to look at casomorphin as a objective measurement of some peptide that might be aggravating this condition. What I want to share with you, though, is the work that we've been doing over the past 8 or 9 years, is looking at levels of casomorphin and gliadorphin in other mental health issues. And there's clear literature now to support abnormal casomorphin levels in depression, ADHD, dyslexia, postpartum psychosis, and the work that we've been doing is with eating disorders and obsessive compulsive disorder. When we talk about casein, there are many sources. It is added to many foods. Many patients have casein-free diets and don't realize that it's added to granola bars or other products in the diet. These are some of the cases that I just wanted to share with you that first made me aware of how casomorphin might fit into non-autistic or schizophrenic illnesses. This is was a 7.5-year-old female that presented to our offices a number of years ago and craving milk. She presented because of the severe OCD. Parents did not want to use medications. She had obsessions of being overweight, being angry, getting others sick and not being good enough, and at age 7.5, constant worries about being fat. Her compulsive behaviors were hand washing and praying. There's a family history of OCD and anorexia. This individual did the casomorphin test and was positive, and by eliminating dairy and adding DPP4 as well as probiotic. And there's a couple strains of probiotics that are particularly helpful at helping further break down casein, that there was a significant clinical improvement in OCD. Next patient, again, presented at age 7. This patient had very, very severe obsessions about not throwing away any garbage, and she hoarded garbage in her room. She brought home soiled toilet paper from school. This patient had multiple medication trials before they came to see me. Celexa, became agitated on Prozac. She was aggressive and tried to suffocate herself and gained 40 pounds. She was treated with inositol with minimal improvement. Inositol is a treatment that we use for OCD. There was some improvement, but not significant. We did the casomorphin and gliadorphin test, which was positive. Eliminating dairy dramatically changed this individual's behavior, as well as the digestive enzyme DPP4. And again, a 7-year-old, very, very obsessive thinking in first grade. If I cannot get rid of these thoughts, I want to kill myself. She, again, was tried on Prozac before she came to see me. Instant relief, and then became uncontrollable with rage and self-injurious behavior that never occurred prior to the antidepressant medication. Again, 3 examples of young children presenting with disabling OCD symptoms and treated with only eliminating dairy, adding DPP4, and there were other nutritional supplements, but there were no other profound deficiencies. DPP4 is a digestive enzyme that sits inside the lumen of the cell. Sorry for that. And if you can see that the gluten breaks down to the gliadorphin and casomorphin inside the cell. The DPP4 enzymatic activity, where you can see the peptides, the gliadorphin, casomorphin, those are the amino acid sequences, and the DPP4 role removes the dipeptide 2 amino acids from the N terminal, which have the amino acid proline and hydroxyproline in the second position. DPP4 is not only set up to break down casomorphin and gliadorphin, it has profound physiological effects throughout the body, and this is just a list of some of the other peptides inactivated or broken down by DPP4. So it's critical for many, many other functions. The pharmaceutical world also understood the value of DPP4, and I don't know if many of you are aware, but there are now numerous diabetic medications that are DPP4 inhibitors. These are some of the drugs and the advertisements that you see, that when you decrease and stop functioning of DPP4, blood sugar goes down. But I assure you, these were short-term studies looking at DPP4 and blood sugar for brief periods of time. Pharmaceutical depression studies are 6 to 8 weeks. I'm not sure where blood sugar studies are, but they're certainly not longer than a few months. Nobody is looking at the long-term potential side effects, and I am very concerned that inhibiting DPP4 is just going to create a cycle of higher elevations of casomorphin and gliadorphin in our patients, which are making them more susceptible to a mental illness. Why is there inactivity or deficiency? This is a slide that Dr. Shaw developed from Great Plains, and there's no simple answer, and his description is the straws that broke the DPP4's back. So there's clearly a genetic susceptibility to the functioning of DPP4. We know that interferon and gelatin from vaccines inhibits DPP4, antibiotics, the wheat and milk, meaning the gluten and casein, so the high quantities that are in our diet could be overstimulating. We know that candida, heavy metals, and nutritional deficiencies affect the DPP4 enzyme. Many of you know part of my interest is looking and understanding the relationship of zinc to eating disorders and other mental health disorders, and DPP4 is a zinc-dependent enzyme. So for all the reasons patients might be deficient in zinc, the most common being taking too much copper, toxins, plastics in the environment, or vegetarians don't get adequate zinc, all could contribute to deactivating or decreasing susceptibility of optimal function of DPP4. Besides the work that we've been doing here in Boston, there have been research to look at these peptide levels in women with eating disorders, and this was one study that just looked at neuroactive peptides, and they were much higher in patients with eating disorders. The patients that are coming into our offices, they're clearly, they don't all have high levels of casomorphin, but the neuropeptide test is a simple way of assessing for that. These are some of the red flags that I use to encourage patients to get this testing, and it's typically intense, obsessional, intrusive thoughts that appear refractory to psychological interventions. So a failure of CBT and also a failure of any medication response. Patients that are excessively consuming dairy and wheat, which is not uncommon in our eating disorder population, that they might be only eating 2 or 3 yogurts a day as the only food that they have. And then patients can articulate quite well that intense feeling of sedation or calm after eating wheat or dairy. I have one patient who used to have oatmeal with a large amount of milk before bed because that was the only thing that calmed them down, by finding out that she had high levels of casomorphine, and eliminating that food, that her symptoms of anxiety improved. Let me share with you a few other cases just so you can get a perspective of some of the patients that we're seeing. I had one patient who actually had OCD but was in control, seeing a local psychiatrist until he went to a health food store and bought some high protein, whey protein powders for a bodybuilding program he was about to begin. So after 3 months of this whey protein, which was a very cheap, not a pure whey protein, so they added large amounts of casein. And this individual's OCD exacerbated without any change in medications, without any known stresses, to the point where he had obsessive thoughts about harming his girlfriend, and actually obsessive thoughts about wanting to kill her, and he needed to be admitted to our psychiatric hospital. When we did the peptide test, found out about the large amounts of this protein powder that he was eating, his obsessional thoughts decreased. We had another patient who had high levels of the casomorphin, whose addiction was to actually coffee mate in her coffee, and she was able to eliminate dairy with some modest improvement, and it was not until we eliminated the coffee mate, which is very, very high concentration of casein, that her symptoms of anxiety improved. And this was a high gliadorphin. This was in a female. He was actually a young adolescent who was autistic spectrum or Asperger's, whose OCD improved with elimination of wheat with high amounts of the DPP4 enzyme. When we talk about a morphine analog, when we talk about a substance that our body or our brain becomes addicted to, we need to understand that that addiction is both significant, and stopping the offending foods can cause significant withdrawal symptoms. It's not uncommon for patients to wake up in the middle of the night, look through cupboards, go out and buy the foods. There's usually a couple days where they do okay, and there are times between day 2 and 3 where there's intense withdrawal symptoms for these foods. And again, many times it's couched in binge eating, where people aren't aware that the dairy or the wheat is the offending food. It just becomes food, and binge eating disorder is not uncommon related to these high levels of these addictive chemicals. The point of this withdrawal cartoon is that for some patients, I tend to try to wean them off dairy or wheat more slowly, particularly the ones that have tried it on their own and said they just couldn't do it because of how addicted they were to these programs. I think when we talk about dairy and wheat, it's hard for us to not understand the cultural significance of these products, and just take a look at the pizza kind of obsession that we have as a culture. So we have the wheat with the gluten and the dairy all in one package. So as a casomorphin gliadorphin addict, if you will, America is certainly the place to get your drugs. There has been some research, not as much as we would like, about alterations in DPP4 activity in patients with depression. So these are not just clinical scenarios that I'm sharing with you. This particular study looked at depression and schizophrenia. And what was interesting is DPP4 was significantly lower in individuals with depression, but were actually somewhat higher in schizophrenia. Unclear as to the mechanism. And here is another autism and schizophrenia paper from some of the original work by Cade. When we talk about public health problems, when we talk about major significant areas where we can intervene, I think the juvenile offenders is a significant problem. And here there was a study looking at how much milk individuals drank. And in juvenile prisons, the incidence of unacceptable behavior dropped greatly after orange juice was substituted for milk. When we talk about milk, I just want to kind of share with you a few thoughts, and then we can have time for questions. All the work that we do is looking at individual genetic susceptibility for mental illness, and then understanding this term called epigenesis, where we can change the genetic information and how it's expressed without altering the genes. So it's important because many of our patients walk in saying, my family had 3 generations of depression, 3 generations of OCD, there's no way that I'm going to be able to recover. And it's important to stress how the genetics is a liability, it's not our destiny. There are lots of things that influence these genetics. Food and nutrition is certainly a major, major intervention. Stress, social interactions, many things affect the expression of our genes. Nutrition, certainly zinc and vitamin D are very, very profound regulators of genetic function. And then there's this concept of polymorphisms, and these are changes in the DNA sequence that can affect resulting protein changes. And these are very, very minor changes. And I'm not going to go through this, but they are changes that are seen in the metabolism of folic acid that has been linked to depression. But what I want to share with you, which was just fascinating to me, is a study that looked at polymorphism of the bovine beta casein on human health. So these are looking at the cows that produce the milk. And there are different forms of casein that are involved in some of the illnesses that we are concerned about. The two most common forms are A1 and A2. And it is the incomplete breakdown of A1 that leads to casomorphine. And these are studies from New Zealand that's looking at the difference in the production of milk, and there are certain cows that produce higher levels of the beta-casomorphin. And these particular cows may be producing the milk that is allowing these kids to be more susceptible to mental health issues. So let me kind of summarize, and then we'll have some time for questions, that integrative medicine for mental health looks at a comprehensive physiological paradigm looking for factors that are contributing to mental illness. The list is very long, and what I wanted to share with you tonight is one very, very small piece of this tool in our toolbox is this casomorphin gliadorphin that the old literature on autism and schizophrenia is important to understand, but our work has shown that high levels of these neuropeptides are found in many, many other psychiatric illnesses, and I am concerned about the use of these DPP-4 inhibitors in the work of the pharmaceutical companies for diabetes. We've written two books, one on anorexia and the other one coming out in the next month on depression, where we go through how casomorphin and gliadorphin can affect these disorders. So I want to thank you for your time and listening, and again, a very, very simple test that can have profound implications for patients' well-being, and I will take questions and try to answer them. I think on your screen you can see where there's the question box. A question was, where can this test be done? And the test can be done. Great Plains Laboratory, which is sponsoring this webinar, does the neuropeptide test, so you can reach them to find out how to get copies of the test. DPP-4, someone is asking, someone asked, what about sheep's yogurt? You know, there is, I believe for many patients, they do react to sheep's yogurt. I've had some actually that said that they did better with it. So I don't have any research to support it, but we try to avoid that as well. Okay, there are a few more questions here. If I can get to that. Okay. How common, in your opinion, are the casomorphin gliadorphin conditions in children who exhibit OCD? Should all children with OCD be tested? Absolutely. The work that we've been doing, I think OCD is the most significant, other than the autism relationship that I have found to casomorphin and gliadorphin. I believe all children should be tested for neuropeptides. In my experience, it might be 20–25%, but the kids are typically the severe treatment refractory kids, and the differences are profound. How long is urine viable for the test? How quickly does it need to go to the lab? I'm going to defer any lab questions to Great Plains. You can give them a call in the morning. What time frame is the weaning period of getting someone off dairy and wheat? What about withdrawal symptoms? I hope I answered some of that during the talk. I typically try to have people taper down over the course of 2 weeks, although it really is individual, and some patients need to go much slower. The quicker one can get off it, the easier it is for them to feel better. Have you seen these neuropeptides causing increase in physical tics? Have you ever seen patients with psychogenic seizures? We've seen a lot of patients with psychogenic seizures in the hospital, have not looked at neuropeptides in that, but certainly tics are commonly related with the OCD and ADHD, and we have seen improvement with Tourette syndrome with the casomorphine. Do I believe 100% of removal of gluten or dairy is necessary? Great question, because every parent and every kid asks the same question. I can share with you the patients that have done the best, the very, very severe OCDs, have essentially eliminated dairy or gluten. I've had many patients who have noticed improvement by just decreasing the dairy and wheat. Many of these patients are the ones that are drinking 3 glasses of milk a day because someone told them it was good for them. Removing the glasses of milk, removing the cheese, but not being obsessive about casein in labels, in granola bars. With the DPP4 enzyme, patients have improved. Are there any natural food sources of the enzyme DPP4 for therapeutic effect? It is an enzyme that our body synthesizes from amino acids and zinc. So getting adequate zinc and adequate protein, our bodies will be able to make DPP4, but with high levels of casomorphin and gliadorphin, I've just found supplementation with enzymes really critical. Question, any experience with individuals with bipolar disorder who have extreme tremors and rigidity on lithium? Well, we treat a lot of bipolar disorder, not a lot association with the casomorphin, but clearly tremors are common side effects of lithium. Frequently we use nutraceutical doses of lithium or other psychotropic medications. There are many DPP4 supplements. New Beginnings is one of the companies associated with Great Plains that has many DPP4 supplements, and you can get more information about that. Question, how does the overabundance of neuropeptides cause OCD and other psychiatric symptoms? What I tried to share with you tonight is that these neuropeptides are neuroactive morphine analogs, and it's essentially injecting large amounts of morphine-like compounds into the brain. And if these are excessive at early ages, then it interferes with development. For some individual, the psychiatric diseases are related to obsessive thoughts, depression, fatigue. So our answer is clearly, as morphine analogs, significant activation of receptors in the brain. Okay, how do we get treatment after the test is completed? The treatment is really eliminating dairy and adding DPP-4. You can work with a nutritionist or a integrative medicine physician or clinician to kind of help you. For some of these young kids, this is the only problem. Then once treatment is done, they are significantly improved. When we talk about older patients with OCD and depression, eating disorders, this typically is not the only nutritional deficiency that needs to get addressed. There are many, many others, and this is just part of what I shared with you earlier, the comprehensive medicine. There was a question about raw milk, and I really don't know if there's a significant difference. Again, DPP-4 is not in the milk. Casein is in raw milk, and you would still require DPP-4 to break down the casein completely. Just to clarify, I did not mean to imply that DPP-4 is high in autistic children. The casomorphine is high in many autistic and schizophrenic children. There was just one study where schizophrenics did have higher levels of DPP-4 that were found in the bloodstream. It did not talk about that these DPP-4 was active, so it could have been a zinc deficient enzyme, so it was not tested for the activity of the enzyme. Can patients ever go back to eating dairy or wheat? Again, great question. And some of those patients that I shared with you that were age 7, I have now followed for over 5 years. And we do reintroduce dairy and casein. And for some patients, symptoms come back incredibly intense, and they realize they can't. For other patients, they can have small amounts of dairy and do quite well. Frequently, if some of these kids are going to birthday parties, so they're not socially ostracized, they might double or triple their DPP-4 enzyme supplement if they have a piece of birthday cake and or some other dairy foods. So we do try to reintroduce dairy and gluten in after a number of years, and many patients do okay, not everyone. Okay, a couple more questions. Someone asked about restless leg and arm symptoms that I've not seen typically associated with this disorder and with improvement on DPP-4. Okay, I think I've answered most of these questions. Let me see if there are a couple more. Someone asked about if someone is on a casein-free, gluten-free diet, is the test valid? And if someone is on a very, very strict casein-free and gluten-free diet, the casomorphine levels could be very high, or they could be normal or low. So we've seen all variabilities. The important thing would be to understand if there's other sources of casein in the diet. So the question was, besides dairy and wheat and the supplement DPP-4, what else can be done to support digestive health to reduce the reaction? Well, for certainly all of our adult patients, we use very high doses of digestive enzymes. Most of the patients are deficient in hydrochloric acid, so we're looking at digestive enzymes with hydrochloric acid. And then, a significantly high, I'm using now 50 to 100 billion, colony counts for probiotics for patients with food allergies or these sensitivities. So there are lots of other kinds of integrative medicine approaches that can be used, again, particularly with adults with multiple psychiatric illnesses. Well, I appreciate your time. Those are the questions that have come in, and I've tried to answer as many as I can. Again, we're talking a very simple intervention. We're talking about profound differences in patients' behavior, and it is just one of the tools that we need to integrate into the treatment of mental illness. Autism and schizophrenia is just a small part of the spectrum where casomorphin and gliadorphin can play a very active role. Again, thank you for your time. If you have questions about the lab test, please contact Great Plains. If you're interested in any of the references, then I'll be happy to get those to you. Thanks again.